Are you aware of the sensations that exist in your body for each of the nervous system states? In long COVID, most of us have been told to focus on symptoms. One thing that I'm always explaining is that it's much more helpful to focus on sensations. Somebody asked me recently, aren't symptoms also just sensations? And yes, that is definitely true. But there are also lots of other sensations in our body, like hunger and thirst and butterflies in your stomach and tingling, that are not symptoms. The most important thing about learning to calm our nervous system is that we need to know what state we are in order to pick the right strategy in order to move up the ladder. And so if we are constantly focusing on symptoms, that's not going to help us because we don't know what nervous system state we're in. It can be a little bit tricky to work this out to begin with, because if we've had a lot of symptoms, oftentimes we don't want to just sit around all day focusing on those sensations. So we kind of get out of our bodies a little bit so that we don't have to be constantly in that pain. This process of getting back into our bodies and noticing those sensations can be a little bit intense. So we're going to take it slowly and I'm going to talk you through it. Also, something really important to keep in mind as you're watching this video today, we are going to go through the 3 states of the nervous system. Typically what happens when we do that is that our body will also go through the 3 states of the nervous system. That means is that if you don't watch this video right the way through to the end and you leave when we're talking about fight or flight, or you leave when we're talking about shutdown, your body will go into that state and it will stay there. So I highly recommend, if you are getting started with this video, just take a look at the timestamp and see, do I have enough time to watch the whole thing? If not, just pause right now and come back when you can watch the whole thing, because we're going to finish in rest and digest, and I want to make sure that everybody who watches this gets to come back to that stage too. First of all, we're going to talk about the sensations that frequently show up in our body when we're in fight or flight. This is probably the easiest one for us to notice because we talk about it a lot and it's associated with a lot of sensations that we're used to noticing. For example, the 4 A's: agitation, activation, anxiety, anger. Fight or flight is what happens when we need to be more focused, and so a lot of processes in our body speed up. It's also really important to flag that fight or flight is not a bad thing. We need all the states of the nervous system. They are necessary, they are functional, and we have them for a reason. In particular, fight or flight is very much about being on your best performance. So you may be able to relate to this as an athlete or a musician, that we need to be in that focused state. For example, if you were going into the hospital for brain surgery, you would want your surgeon to be in that focused on state. So probably they're going to be in fight or flight. And I can certainly relate to that. When I worked in hospitals, there were particular situations that we needed to be in fight or flight, and it's really crucial and it's really important. Typically when we think about fight or flight, the first things that we're going to notice is faster heart rate, faster breathing. Energy does show up in this stage, and this one is a little complicated for us because obviously energy is complicated in long COVID, but you may notice that you do get a little bit more energy if you go into fight or flight. That is definitely fickle, but it's part of the metabolism that's happening with the adrenaline and the cortisol. You can get more focus, but you can also get anxiety, you can get restlessness, irritability, and it can also be harder to focus depending on the situation and what's happening. This is also a place where you might get racing thoughts or intrusive thoughts, and behavior-wise, you may notice that you raise your voice more, maybe use more choice language or call people names, say things that come across as aggressive or angry or impulsive or confrontational. Again, no judgment here. This is all a normal part of fight or flight. And for those of us who have long COVID and are in extended fight or flight, this is definitely something that we go through. And I remember being in that stage, going into doctors' offices, getting angry with the receptionist. That's just a normal part of this. So please don't be down on yourself if you notice those behaviors. If you're someone who has POTS or MCAS, and many of us have both, this is where you may see your POTS and MCAS symptoms show up. For me, for example, I used to get a lot of chest pain. That is a big MCAS symptom. Definitely, I noticed over time that was a sign for me that I was going into fight or flight. You may also have things like clenched jaw, pain around your back or your neck, and then that other one where we tense our body. Certainly this is something I can relate to pre-COVID. I would often notice that I was someone who was walking around with my fists clenched the whole time. Other people are kind of walking like this with their arms almost like a T-Rex dinosaur. Some people get that horrible jaw pain because they clench their jaw or they grind their teeth. All of those are signs of being in fight or flight. Another thing that is really common, many of us get called out on this as children, is sitting with so-called bad posture. Actually, what we're doing when we hunch our bodies forward is that we're naturally bracing in a protective position. This front part of our body has a lot of vulnerable things that can be harmed, right? Our heart, our lungs, our liver, all of those are right in the front here. And so it's very natural when we have had trauma to kind of walk around hunched up so that we're sort of protecting ourselves. If you notice that you are someone who has so-called bad posture, that may be a sign that you are in fight or flight. And you may even have noticed that as I'm talking about fight or flight, my talking was speeding up a little, which may be because I am also getting pulled into that stage a little bit. And so you will see, as I flagged at the beginning of the video, when we talk about and think about what happens in these states, we do very often go into them. So we are going to go down the ladder now into shutdown, but please stay with me, because when we finish shutdown, I'm going to do a little polyvagal strategy to help you move up, and then we're going to finish with rest and digest. And again, you may notice that I get a little quieter and slower here, and then we come back up again. Shutdown. Again, this is one that we talk about a lot. Sometimes it can be confused between calm and shutdown. So when we're in shutdown, we are much more likely to be experiencing that fatigue, that heaviness, and that withdrawal. We also talk a lot about GI symptoms. Constipation and slowing of the gut are much more likely associated with shutdown. If you are having too much bowel movements, diarrhea, cramping, those kinds of things, that is more associated with fight or flight. And then interestingly, insomnia kind of straddles a little bit of both. Because when we're in shutdown, we also don't sleep. We're not getting rest because we're not in a restive state. Insomnia is usually kicked off by fight or flight, but very commonly also continues when we're in shutdown. We have that horrible heaviness in our body. We don't have any energy, but we also can't sleep very well. Another really crucial one that we can notice for shutdown is our facial expression. Normally, when we're in rest and digest, we're going to have a lot of facial expression, facial movement. When we're in shutdown, our face becomes what they call very flat. So there's very little movement, very little facial expression, and also, interestingly, that goes along with that is a monotone voice. Normally when we're speaking, again, we have vocal range. It goes up, it goes down, and when we get into shutdown, we lose that ability and everything comes out on the same tone. This is something that you may not notice, but other people will see. And it's a really good way to measure our recovery. And if friends and family are commenting, "Oh my goodness, your face looks much more smiley and reactive," that is what they're talking about. Interestingly also, vocal fry, which has been talked about a lot, I guess, In certain parts of the US in the last 10 years, a lot of people don't like that sound. It's kind of a scratchy, monotone vocalness. That is also very common when we're in shutdown. Famous people on social media who have vocal fry may have nervous system issues. Many of you may know that when I was very sick, I still was endeavoring to work, being self-employed. I don't get sick leave, and that was really tough financially. One of the things that I used to do a lot of were online trainings. And there are some wonderful clips of me from online trainings where I am saying, I'm so excited that you're here today. But actually it comes out as, I'm so excited that you're here today. And if you're interested to laugh at me with my monotone and flat face, we'll pop that clip in for you to take a look. I am so excited to finally be able to share this online course with you. When we're in shutdown, the other thing that very commonly happens is feelings of sadness, hopelessness, helplessness. This is where thoughts about ending our life can also show up. It's very common. It doesn't mean that there's something wrong with you. Most of us with long COVID have gone through this. If you are having thoughts of ending your life right now, please scroll down to the description. We will post some resources of hotlines that you can call that are there for you and can keep you safe. You also won't be surprised to hear that shutdown are the days when you are struggling to get out of bed. It may take you 2 hours to get through the shower, to get dressed, despite not really being able to do anything throughout the day. When it comes to bedtime, you don't really want to get back into bed because you're not really sleepy and you know that you're just going to lie there for hours and battle with insomnia. So before we now come on to rest and digest, let's take a moment to do a brief polyvagal strategy. And the one that I like to do here is rocking. Now, some people find that their body likes to rock left to right. Some people find that their body likes to rock forward to back. Just pay attention to your body, whichever feels comfortable for you. For me, I like to go side to side, but don't feel that you have to mirror me on the screen to do that. So we're just going to take a moment and keep doing the rocking until you feel your body moving up the ladder. And if you need to pause this video and rock a little bit longer by yourself, feel free to do so. And I definitely noticed just from doing that for a second that my body is doing a big exhale. And yeah, I'm feeling like I need to shake it out a little bit. And that definitely for me is a sign that I'm moving back up the ladder again. Now, the first thing to say about rest and digest is that you may not have seen this state in a very long time. And there is a lot of confusion between shutdown and rest and digest, especially when you use the word calm. Because yes, when we're in shutdown, it is a bit calmer. There isn't the agitation, there isn't the anxiety, there isn't the activation that shows up with fight or flight. It's also not calm when we're in shutdown, it's just shutdown. Calm is much more about safe and secure. When we're getting into rest and digest, what can be really helpful anchors to notice are much more kind of positive things that show up. Acceptance, gratitude, joy, curiosity. We're likely to be feeling much more socially connected, confident, interested in things. Common behaviors that show up are the opportunity to do all of the good things. Your facial expression is going to be more animated, that vocal range comes back, we're interested to hang out with people, we definitely want to maintain eye contact. When we're in shutdown, that can definitely go away again. You may also find yourself much more able to speak your mind in a healthy way and much more able to make your point. There is also playfulness, and this is a huge part of rest and digest, and it helps us to stay in that state and reinforce that state. And you'll also find that you don't have tension in your body. There's much more looseness. We're not doing that bracing thing the whole time. Naturally, we are much more able to sit up straight. Nobody needs to ask us to do it. And then also, we won't have symptoms anymore. Somebody yesterday asked me, did I want to see their symptom tracker? How will they know when they're feeling better? I cannot say this enough. Please don't track your symptoms. When you feel better, you will know, because you will feel better. You don't need to be saying, oh gosh, I haven't had rashes anymore. I guess I must be feeling better. You will know that you feel better because you will feel better. So if you are not sure if you are in rest and digest, you more than likely are not in rest and digest. And I can promise when you get there, it will be obvious. It was obvious for me. It was very exciting. Lots of gratitude. You will definitely get there. Well done for making it through this video. There was a lot of information there and a lot of intense information that could have taken your nervous system on a bit of a journey. This is a great moment to take a pause, let yourself take a breath, and remind yourself that you are doing a great job by being on this healing journey. If you would like to continue this healing journey, I highly encourage you to click the link in the description below. I hope you have a tolerable week, and I'll see you next time.